Okay, here you can just see the case in which the patient presented with the already diagnosed depression, and patient was prescribed sertraline, but and you have to talk to the patient. The patient has come for follow-up. So first of all, like as always you do in Plab 2 introduction, and then you will say, I understand that you have been on sertraline for your depression, and today I would like to see how you have been getting on and how the medication is working. If you have any concerns, so first of all you a little bit can ask about symptoms like how has your mood recently, and are you still able to enjoy the things you used to, and about ask about energy, concentration, appetite, and sleep. And you can ask about the suicidal ideation, like by any chance you have thoughts of harming yourself or anyone around you. And then just here an important section here, medication adherence and side effects. You will ask about the sertraline, like have you been taking sertraline regularly. Patient will tell that not, I have stopped taking sertraline. Then ask about the an improvement that the medicine has added to your life. Have you noticed any improvement in your symptoms? Have you noticed any side effect of the medicine, like GI upset, like stomach upset, headache, sexual dysfunction, sleep issues. You can ask about the side effects. You ask about improvement in your symptoms, and then you can ask about did you have any difficulties when you started it, like you have you taken it for 4 to 6 weeks to work, because medicine antidepressants take 2 to 3 weeks to function. Then ask about the work, relationship, and daily activities, and how is it impacting your life and relationships. And you can ask about the thoughts of self-harm, as already mentioned. Then ask about the safeguarding, like any family, children, dependents. And then ask about the previous history of depression, episodes of depression and treatments, medical conditions. And ask about the alcohol, smoking, recreational drugs, and coping mechanisms, support groups, and then ideas. And then at the end, validate the patient experience, reassure the side effects are common but usually settle down on its own, reassure the patient and validate the patient's experience. And then medication continue the sertraline if tolerating and improving, and if not improving, the patient is not improving sertraline after adequate trial of 6 to 8 weeks, consider dose adjustment or alternative SSRI that will can be done by the GP or psychiatric department. And discuss compliance and importance of not stopping suddenly. Recommend cognitive behavior therapy or talking therapies, and lifestyle, sleep hygiene, reduce alcohol, caffeine intake. And by any chance if you develop suicidal thoughts, assess the severity, urgent referral. If high risk, can arrange review in 4 to 6 weeks, and provide information leaflet, crisis helpline. And always cover the mood symptoms, side effects, adherence, suicide risk, provide safety netting, empathetic list.